There are funders who don't understand what mental health and emergency is. Cuts in humanitarian aid, one of the first programs to be shut are mental health, unfortunately. Mental health was something of a luxury. If you were lucky, once you get displaced into another country, you would wait for months or years to get some support. What people often don't understand is how important it is to deliver that type of support immediately after the crisis, not as a nice add-on, but as an essential component for people's recovery, regaining resilience, regaining their powers to proceed. First responders, in most cases, are the local ones. Building their capacity in mental health and psychosocial support, the same way you can train anyone to provide life-saving CPR, you can also train in mental health and psychosocial support. Mental health, especially in emergencies, is life-saving.
Welcome to Mind the Gap, a podcast about what's missing in global mental health.
I'm Christy Savetta.
I'm Chris Underhill.
And we're here to explore the stories, solutions, and systems shaping mental health around the world.
From community champions to global change makers.
Let's dive into what's working and what's not.
And what it'll take to close the gap.
Welcome to another episode of Mind the Gap. On this podcast, we often talk about the gap between mental health support that people need and the systems that exist, and why that gap exists around skills, funding, etc. And today's conversation takes us into a really acute version of that gap. What happens when mental health needs surge in the middle of conflict, displacement, disaster? Our guest today is Maria Jammal, CEO and co-founder of Humanity Crew. Maria is a lawyer, humanitarian leader, and one of the people working to make mental health and psychosocial support a more central part of emergency preparedness, response, and recovery. What I find super interesting about Humanity Crew's work is that it challenges the idea that mental health support begins after a crisis. It asks a different type of question. What does it look like if communities were better prepared before emergencies happen? So today we're going to talk about emergency mental health and what Maria is seeing from the front line of humanitarian response in today's day and age. Maria, we are so excited and happy that you're here with us today. Thank you so much for joining us.
Thank you, Christy and Chris, for having me. I'm excited to be here.
Yeah, we are really pleased that you could join us. So let me just jump in, Maria, and ask you a very obvious question. How did you get into this whole question of mental health and emergency mental health?
I actually came to this through the Syrian refugee crisis. In 2015, my partner, Isam, who is a child psychiatrist and psychotherapist, and myself went to volunteer at the Greek shores, supporting Syrian refugees and then other refugees from other locations. And what struck us was the gap in mental health and psychosocial support. We see that many different services were provided: food, shelter, clothes, important basic needs, but no one was really asking them, how are you? What are you going through? How are you going to proceed? What do you need? What are the gaps that you have that prevent you from proceeding, and so on. So we immediately identified that mental health was something of a luxury. They didn't have these services in place. If you were lucky, once you get displaced into another country, you would wait for months or years to get some type of support. And from that gap, we decided that this is what we were going to do. We established Humanity Crew to respond to that specific gap, to provide mental health and psychosocial support immediately or during an active crisis.
Well, that's a really helpful background. So in a sense, you were precipitated into this whole question of mental health and psychosocial support by an actual event in its own right, the whole question of Syria and so on. What do you think? People talk about mental health more now than they used to. I think that's generally true. But there must be many misunderstandings about emergency mental health. What do you think some of them are, and how do you counter them?
First of all, mental health and psychosocial support, what we call MHPSS, is the humanitarian term for that. This is the support provided after a major crisis. And what people often don't understand is how important it is to deliver that type of support immediately after the crisis. Not as a luxury, not as a nice add-on or a plus service to have, but as an essential component for people's recovery, regaining resilience, regaining their powers to proceed, building that strength to carry on their families, their surroundings. So it's very essential to have this type of support as soon as possible, and it will dictate how you proceed, and it will dictate the rest of your life and recovery after this traumatic event.
Yeah, so that's the whole point, really, isn't it? That if you don't intervene quickly in somebody's emergency, and then obviously what's going to happen is that that's going to be affecting them for many, many years to come. Absolutely. So today we're going to talk to you about a number of facets of the work that you do at Humanity Crew. And I'm going to go back to Christy to talk to you about the first part of that.
Right. And I think what's really interesting is your work really started like after the crisis, right? And I know over time you started to think a little bit about what that looks like to intervene beforehand. So could you talk a little bit about the thinking around the establishment of the Preparedness Hub, what that is and what it looks like?
The early intervention is actually prevention. And we know this in mental health as well. The sooner you intervene, the higher chances for you to not to develop psychological or not to have psychological deterioration. So we want to be there as soon as possible. How do we do that? We have the deployments of emergency teams like we do at Humanity Crew and others, but we also identify during the years that the first responders are mostly, in most cases, are the local ones, are community members who are responding or volunteering to respond to this crisis and support their communities. So they are there in time, they understand the culture, they understand the needs, the language. And what we identified is that building their capacity in mental health and psychosocial support, the same way you can train anyone to provide life-saving CPR, you can also train in mental health and psychosocial support interventions and skills. We're not talking about creating new psychologists or making the local community all mental health professionals. We're talking about certain skills and know-how that is critical to be delivered during crisis and even before crisis. So this is where we identified that we know in some places, in many places, we know that disasters are going to happen. Some places have recurring disasters, some have really high vulnerabilities and low resources. This is why the impact of disaster is much, much stronger. So we work with local communities in areas that have trends of disasters in building their capacity to integrate mental health and psychosocial support to their daily work. So they get prepared before the disaster even happen, and when it does, they continue to support the community that they normally serve, but also with a mental health lens as well. Again, we're not talking about therapy now, but we're talking about certain interventions like psychological first aid and different interventions, identification of stress responses, stress management, skills and tools that are very much help the community to cope and eventually recover from this with minimal impact in the long term.
Super interesting. So you work with organizations that are not necessarily mental health specialists and individuals that aren't mental health specialists, and you're training them on a variety of skills, psychological first aid, resilience, coping, stress management, and they're then providing that service to individuals after an emergency happens, and sometimes before, as you mentioned. Could you give us an example of an area or a region where you've recently deployed this model?
Yes, we started 2 years ago with this model, implementing successful pilots in Nigeria, Uganda, Tanzania, also now in Palestine. I can give an example in Nigeria. One of our partners, Nuru Nigeria, they work in agribusiness and livelihoods with the farming communities in rural areas. And in even initial conversations with them, they shared that the farming community that they support have trends of disasters like flash floods and landslides that affect their crops and lands and houses. And when that happens, they really don't know how to support them, what to do, what to say, where to refer. This is the partnership. We had a 1-year partnership with them where we do intensive trainings, 3 in-person visits to that location, where we work with the entire organizations in building that capacity in psychoeducation, identification of stress responses, psychological first aid, like we talked, and more. We have our adapted minimum service package for MHPSS. And then we continue between these in-person trainings. We also provide technical workshops, supervision, adaptation to the program. So it's an ongoing process with the local organization, with the partner, in implementing that MHPSS in their work. So they are already, during the year, they are already introducing what mental health is to the community. So that also reduces stigma. It reduces the barriers to then accept or get mental health support following a disaster or when the community needs. And we already have seen in actually all of the locations, all of our partners, and specifically with Nuru Nigeria, we already seen that they had several instances of flash floods and landslides impacting their community, and they were able to already respond properly with a duty of care to their own staff as well, with do no harm principles, and they already understand how to do it, how to support one another as organizations as well. Something that they didn't have before. And we continue supporting them remotely in the process as well when they experience these disasters.
Oh, wow. Your model sounds incredibly comprehensive. And what's really interesting, just I'd want to pull out and just mention again, is it sounds like even though like they're already integrating the mental health language, discussion, concept into the community even before a disaster. So let's say a disaster doesn't strike. If we're very lucky, there's no disaster. They're still developing and deploying this language around mental health, reducing stigma, and preparing individuals, if they have a disaster in their own individual life, for instance, to potentially even be resilient in that way and in that pathway, which is really interesting. It's almost like a no matter what happens, you have an element of success as a part of the model. And I'm curious, when you talk about some of the pilots and the work that you're doing, how are you looking at measuring success? What does success mean to you in terms of like how you think about your programs and that the Preparedness Hub is working?
We have our log frames and data that we collect, including like we see a better confidence and understanding of all of these training materials, how often they implement those, how secure and confident they feel about doing this process. But eventually, at the end of the day, we see in these examples, in these cases, we see a successful implementation of a MHPSS during an emergency. That's where we know that, okay, so the process that we did, it's not only theoretical, and the training that we do is very engaging. It's integrated. There's no one hub having exactly the same training and the exactly the same manual like the other one. The contexts are different. The community is different. The focus area is different. The disaster that impacts them are different. So that's eventually the success for us, having a network of people from different organizations, different locations around the world, working in different sectors, able to respond. And like you said, Christy, eventually we hope that we don't have disasters and we don't have the need for them. But also important to know that a disaster, the definition of a disaster is when you have some sort of a hazard or event, like an earthquake, for example, but you also have in the same location high vulnerabilities and low resources. So that's the whole concept of disaster risk reduction. What can you do in the community in advance so that any impact or any a disaster doesn't have a major impact on the community that will then require, international interventions as well. So what we are doing actually is integrating mental health and psychosocial support in different sectors, and we're also localizing the support so that the local communities know what to do and how to do it best, and have the skills and the capacity. And we're by this, we are minimizing our international footprint while giving them the capacity and the agency to continue that support in the future.
Got it. Got it. So Humanity Crew is looking at kind of minimizing your international footprint and really deploying your work through local communities with that localization lens. And I think that point around kind of the definition of disaster, where you have these high vulnerable, low resource communities, even without a disaster, mental health still is an incredible and critical part of supporting individuals throughout their own lives. And then you add the disaster on top of it, it makes it even more important, more imperative to make sure that you have that element of support. So I'm going to hand it back to Chris here just to talk a little bit about kind of where Humanity Crew kind of does more like direct interventions, not necessarily like a training through trainer model, and to work through some of those elements.
Yes, thanks, Christy. So Maria, obviously you also work in direct emergencies, and that's part of your work. And maybe first of all, you could give us a couple of examples of where you do that and how it turns out.
So yes, this is how we actually started. So we have pre-positioned staff on our emergency teams that we deploy to emergencies. In the past, we worked, as I said, in the Syrian refugee context, but also the Turkey earthquake, for example, refugees from Ukraine in Poland, the Myanmar, Thailand earthquake, Morocco as well. So different contexts, different geographies. What we do is we deploy our teams to the ground. We do an assessment, an MHPSS assessment to see the needs, the vulnerabilities, who's doing what are the gaps, and then we built our plan of interventions. During our emergency response, we always prioritize locating local partners that we can partner with to build their capacity in creating a hub, like we did in different contexts there already, and similarly to the preparedness hubs. So we capacitate local organizations to be able to carry that forward. And at the same time, while we continue our own interventions on the ground. Part of our intervention is also supporting frontline workers. This is the main part of our MHPSS interventions during crisis. So whether it is international organizations on the ground or local organizations, really anyone who would require our support on the ground, that's one of the things we provide. Currently, one of our emergency responses is in Gaza, but done remotely for the past almost 2.5 years. So because of the security situation and restrictions of access, we were able to provide remote support to frontline workers who are themselves from Gaza mostly, and have been and are being impacted by the war there. So normally frontline workers, they are exposed and they are experiencing secondary symptoms of the traumatic event, or they are exposed and they do need support on regular basis, and especially in places like Gaza, where the community of frontline workers come from the community and are impacted. In Gaza, for example, most of them have experienced loss, they are displaced and have experienced everything from what their beneficiaries experience. So it's very important and critical component of our work is to support them to regain their well-being and maintain their well-being while they are supporting other people in the community.
Right, I see. That's really interesting. So you deploy an emergency response. That's obviously top of mind when an emergency begins. But then you have this idea of, as soon as you identify local partners and local organizations, you have this idea of creating the preparedness hub, or what will eventually be the preparedness hub, so that you're kind of installing some kind of sustainability in the situation. And that makes a lot of sense to me. And then obviously you see another group of people there, apart from those who are directly affected by the emergency, who are these first responders who are there already. So could you just break down for us a little bit what it is like? Give us a sort of insight into what it's like if you were a first responder, for example. If I was a first responder, what might you offer me? What would be the kind of program that you would offer me?
It's important to mention also how we provide that support. Let's keep talking about the Gaza context, for example.
Okay.
Part of organizations' duty of care is to care for your staff and deliver support to your staff to be able to continue this work.
Yeah.
In Gaza and context, in specifically, we are providing group decompression sessions and one-to-one stress management sessions.
Right.
In different contexts, it may be different. Now we're entering a phase of doing a training on how to run a decompression sessions so that the frontline workers are able to provide this to the community.
Right.
In many organizations, or some organizations, not many, have a duty of care responsibility and have kind of some sort of support to their frontline workers, but it's often a hotline or a phone number that the staff can call if they need any support. In many cases, we hear from partners that no one really uses that.
Yeah.
So what we have been doing in Gaza is an outreach to the community, and it took a lot of time to do this mobilization in the beginning to build that trust for people to understand why it is needed, because in many cases, including myself, honestly, when I started as a frontline responder 10 years ago, I didn't really admit that I needed something or that I needed help or talk to anyone about what I was experiencing, even though it was very overwhelming for me. So we do an outreach. And in many cases, we see that when we do one group decompression sessions, most of the group would want to follow up with one-to-one stress management sessions, and they ask for more. And when there's this more and more engagement, we're also providing flexible type of support, and especially in contexts like Gaza, where communications is really not stable, and we try to use different methods, whether it is a WhatsApp call, a Zoom call, a regular phone call, just checking in on messages. So we try different modalities so they know that we are there, we are listening, we're present, even if there are airstrikes now and communications is lost. And so we maintain this relationship a longer term, and we build this trust within the community, which takes time also.
I can imagine in a situation like that where the event is ongoing, the war is ongoing, the uncertainty is very high level and so on. It must be, well, looking at it from outside, looking at it not being involved on a daily basis, it must feel, well, on the one hand, the person is continuing to be stressed, and on the other hand, you are providing a decompression of one kind or another. Does it sometimes feel like a kind of wheel constantly turning, or what's the kind of logic behind it?
It does feel like this sometimes, but we also see the progress with people over time. So if we had sometimes people don't show up to the meetings, and then we follow up with them, and they hear feedback from other colleagues, and then they try to join, and then they ask for more. There's a gradual process in it. And we also see the improvement in their well-being, and we see that through actions that they do in their day-to-day routine. So for example, we work with them on coping mechanisms. What are coping mechanisms? What do you use as coping mechanism? In many cases, we see like negative coping mechanisms that we try to avoid. A good routine that they had before that they appreciate, whether it is community activities or their personal well-being. We see women psychologists who have been working very, very severe cases, turning from really like very bad mood, anger, a lot of frustration, to really putting on makeup and coming up to the session relaxed, and saying that she has now ritual of drinking coffee before starting sessions. These like little things are not important. They are significant for that person well-being routine day to day, especially when every day has their own complexity. So maintaining that stability, in a sense, regaining routine in a place where there's no routine, constant changes, that's like, these are the things that they hold on to. And also they understand what are bad coping mechanisms for them and what they can lead to. So we do psychoeducation as well in the process during these meetings, and supervision and so on.
You know what came to my mind as you were talking? It was like when you were talking about those incremental benefits, those small and not insignificant incremental benefits, it sort of felt like you were making a contribution to the building blocks of their civilization. You're making a contribution to the very building blocks of how they can live, which then brings your whole work into another dimension, doesn't it? It's not just about, important as that is, it's not just about mental health or mental illness turning into mental health.
It's what we call building their functional resilience, their ability to function under stress, cope with the stressors, their ability to maintain doing their work each and every day. So we do talk about how this contributes to functional resilience of the community.
Yeah, I think that's a really important part of it. Christy, back to you.
And I imagine, in a world where it seems like we are, like disasters are inevitable these days, is how it feels sometimes, right? Even I think someone not working within the sector could feel hopeless sometimes when looking at where we are from a global dynamic perspective. You are in the thick of it, and the people that you're working with are in the thick of it, in the disasters that you work towards, not just on a global scale, but also, as we were talking about, disasters driven by climate change and other elements. What gives you hope? I think the way you're talking about this, like functional resilience component, seems like something to kind of cling on to, but what gives you hope?
I think looking at the community that we serve and seeing their resilience and how they maintain hope, this really what gives me a lot of hope myself, especially during times where myself, like living through an ongoing crisis here as well. Also my team, a lot of support from the amazing team that I have, and we support one another as well, part of maintaining one another as well. So I am hopeful also for more and more understanding and value for mental health globally. If 10 years ago I was really trying to convince and explain more what it is, why is it needed, today I think this conversation has shortened. People understand more that, and putting mental health more to the forefront, while it's still under prioritized, but the impact of it is really huge, and I am hopeful that this will continue and continue building and evolving, especially where more and more people are talking about localization and integration. I think that would be the key for seeing that solution to this global problem.
Absolutely. I think that's fantastic response. One of the things I just want to pick up on there, you talked a little bit about it still being a little under prioritized. So kind of with your hat on as a CEO of an organization working within the sector, mental health sector, but also the humanitarian sector, the emergency response sector, what do you think people are still missing when it comes to emergency mental health? Let's take funders, for example. What do you think funders are still missing when it comes to emergency mental health?
I think the understanding of, there are funders who don't quite understand what mental health and emergency is. So people think that mental health, we're talking about like a long-term process, therapeutic process that will happen or come after the disaster. And this is exactly what we're trying to prevent, or not prevent, but reduce, because early intervention reduces the chances for that long-term psychological intervention. And the other thing is the importance and the urgency of mental health support. And I also myself work and talk in many different platforms on the importance of it, but this needs to be more. This is not enough. More and more global platforms are there now for mental health, but still not enough, not prioritized. We see in the first cuts in humanitarian aid, one of the first programs to be shut are mental health, unfortunately. So I think there's need to be more work on explaining or convincing donors that mental health, especially in emergencies, is life-saving and is preventing many other difficulties in the future, but also it's an enabler to other services. And that's what I think many donors miss, that part of enablement, whether we're talking about the well-being of strong frontline staff and their capacity to be able to cope themselves and continue working, or with the community. It's an enabler for the community to stand up on their feet, function well, reduce the vulnerabilities of the community, help one another, build back the community. You need that mental health well-being in order to continue. So not to wait for mental health to be delivered later as a luxury service, but include it early on. Include it in the budgets, include staff well-being in the budgets, because it's really critical to the quality of the work and to the reduction of the do no harm for the community.
Do you see with the work that you're doing with the frontline workers, you talked a little bit about these elements of like functional resilience and seeing kind of a step-by-step change in the frontline workers. Are you seeing that as well with the individuals that the frontline workers are supporting? Are you seeing that kind of step-by-step change within their own lives as well?
We don't currently track the change in the community. Part of that will be in the next phase of our work when we will start doing the training of trainers for the decompression. So when the partners will start delivering the decompression sessions, then we will know feedback on that. But overall, what we hear from the frontline workers that there is an increase in their well-being. We use different tests and methodologies to see improvement in their total well-being, in their understanding of needs of the community, in how they feel, in the stress levels and so on. So
Right.
we don't currently look at the direct impact on the community level. We will soon, but we do see that a direct impact on the community of the frontline responders.
Right, which makes a lot of sense. And we know from a lot of literature as well that the more supportive the frontline worker is, the stronger we tend to see the outcomes. That's a relatively well-structured effect between the two of them. Be
Yes.
curious to see when you measure it, what it looks like for you all. Thank you for diving into that detail. I mean, I think one final question for you from me, then I'll hand it back over to Chris to wrap us up. With kind of zooming out a little bit in terms of the work that you're working on, the relationships that you have within your own organization, but also from a broad perspective, like your relationship within the mental health sector, the emergency sector. What is, for you, what's most on your mind right now? What is a thing that keeps playing around? What's like a very important thing that you continue to think about? What's a challenge that you're thinking about addressing? What's most on your mind these days?
Honestly, with the humanitarian reset or whatever they're calling it right now, on top of my mind is funding, is securing funding for this program, is working on advocating for inclusion of mental health in humanitarian response, getting more resources to mental health and psychosocial support. That's on top of mind at the moment, while we continue working with local partners in the different contexts of our work.
Sure. Makes a ton of sense. Good luck. Best of luck with that as we navigate the world that we are in now. And I hope to see you, continue to soar as the work that you're doing. Chris, over to you.
Thank you. Well, Maria, we're coming to the end of the program, and my goodness, I think what strikes me mostly is what a complete program Humanity Crew has developed. First of all, we talked about the preparation of preparedness hubs. And you brought out a really interesting example of agriculturalists working in Nigeria, and people listening to this podcast, they wouldn't have immediately thought of agriculturalists as being, so important in that context, and agricultural extension workers and so on. And incidentally, I was originally an agriculturalist, so my mind was, immediately taken back to those farmers, and because I worked in low-income countries as an agriculturalist. So I could see the logic of it, and that, is really interesting from my point of view. Just as I could see the logic of your working in your more emergency-related response, of your working incrementally, step by step, so as to help people, of course, at one level, rebuild their lives, but at another level, rebuild their own psychological stamina. And that, to me, seemed to me really important. So just on behalf of Christy and myself, thank you very much indeed for taking the time with us we kind of feel guilty that we've taken your time. But
You're helping me spread the word, Chris. This is extremely important. Thank you for this opportunity. Thank you,
yeah,
Chris.
well, it's lovely to be with you, and thank you once again.